Next one, the third point, that is effect of elimination half-life on duration of activity. So how the half-life will be influencing your action shown by your drug. So that is duration of activity, how it is getting influenced by your half-life. Okay. So in any disease state, what happens? Pathological changes takes place in hepatic or renal function. So either of that will be affected. That is, you will be having some deviations in your hepatic function or renal function. So thereby what happens? You will be seeing a decreased elimination of the drugs when compared to the normal healthy individuals. When you observe any drug content in patients who are in disease state, you will be seeing some decreased elimination of the drug. So what happens? If decreased elimination of the drug is there, you will be getting a half-life, that is increased half-life you will be seeing. That is nothing but it is very time taking. Okay. So your prolonged half-life will be there, which leads to the retention of the drug in the body. So if retention of the drug takes place in the body, what happens? You will be seeing the increase in duration of action of the drug. That is nothing but it will take much time to show its action. And if the drug is getting deposited, that is nothing but if it is retaining for much time in your body, what happens? You will see the toxic reactions. So this is the effect of elimination half-life on your duration of activity. So you have to see that whatever the preparation which you have done, so that should not give the prolonged half-life. Okay, in only certain conditions you can go for half-life, but normally it should not be high, because if prolonged half-life is there, that leads to the deposition of your drug molecules. That is, the drug will be retaining in your body. If drug is retaining for longer periods in our body, it leads to the drug toxicity. So this is your effect of elimination half-life on duration of activity. Next one, fourth one, that is rate of drug absorption and pharmacodynamic response. That is absorption and pharmacodynamic response you are going to study. So the rate of drug absorption influences the rate in which the drug gets to the receptor and shows a subsequent pharmacological response. So whenever you take any drug, first absorption should occur. Okay. So then only it will be getting distributed to various organs, that is it will be getting into your blood. Okay. So to show its action, first it will bind to the receptors. Okay. So the rate of drug absorption will depend upon the amount of drug that is getting absorbed into your receptors. Okay. So it is shown by one example. Here you can see niacin. So if it is given in an immediate release tablet, so what happens? If immediate release, what happens? Whenever you give take that niacin, so you will be seeing within 5 or 10 seconds or minutes, you will be seeing that rapid systemic absorption will be there. So in the immediate is nothing but it will be showing very high, that is your release of the drug will be very high. So it leads to the rapid systemic absorption. So whenever a rapid systemic absorption occurs, it leads to vasodilation. So if vasodilation occurs, it causes fluctuation and postural hypotension will be observed. So as these are causing some defects or adverse reactions whenever you are giving us immediate release tablet, so you are seeing some vasodilation conditions and fluctuations and postural hypotension you are observing. So that's why we should not give such tablets as immediate release. So we have to choose the extended release. Okay. So this is nothing but the extreme rapid absorption may have an intense and possible harmful effect. So this is applicable for only some drugs, but not all the drugs will give like that. So here we are showing the example how the rate of drug absorption and pharmacodynamic response will be there. So for that you have to explain about this. The niacin, whenever it is given as an immediate release tablet, you will be getting the rapid systemic absorption of the drug, which leads to the adverse effects like vasodilation and fluctuations and postural hypertension will be there. So for that purpose, you should not give niacin as an immediate release tablet. You have to choose the extended release only. Okay. So that is rate of drug absorption and pharmacodynamic response. Next, fifth one, that is equilibrium of the drug. So for some drugs, the half-life of drug equilibrium has been estimated by observing the onset of response. So that is nothing but based on the half-life. So you are going to check the response shown by the drug. So here are some examples like drug like D-tuberculonin. If the equilibrium half-life is 4 minutes, you will see the pharmacological response such as muscle paralysis will be there. And if you take the drugs like quinidine, so if the elimination half-life is about 8 minutes, so you'll be see QT prolongation. So these are some of the pharmacological response shown by the drug whenever you will see the equilibrium half-life. Okay, so these are the examples of the drugs which shows this equilibrium half-life and what is the pharmacological response shown by that one. So what are the factors that affect these parameters means, so the first one is perfusion of blood to the compartments and blood tissue partitioning, protein binding, drug diffusion from capillaries to the affected compartment, and elimination of drug from the affected compartment. So all these factors will reach which lead to the formation of equilibrium half-life. So if equilibrium half-life is there, you will be getting some pharmacological response, then normal response. Okay, so it will be generally some alteration in the response will be there. So if the equilibrium half-life is like this, you will be seeing some pharmacological responses like this. Okay, so how the equilibrium half-life you are getting means, by all these parameters you will be getting the equilibrium half-life. Okay, so all these factors will affect your your drug to get into the equilibrium half-life. Okay, so this is your fifth point. Next, sixth one, that is drug tolerance and drug dependence. So drug tolerance is characterized by reduction in pharmacological response after repeated and continuous drug exposure. Suppose if you are giving continuously, you are giving the drug but it is not showing response, so you may think that the dose is not enough. So continuously you will be administering the drug into your body. So what happens, it leads to toxic reactions but it will not show any disease. Okay, so the development of tolerance have a significant effect on the exposure response relationship, and if it not recognized can contribute poor clinical outcome. And PK and PD modeling can be very helpful tool to characterize the time course and magnitude of tolerance development. So as you know that many drugs will having some tolerance is nothing but, so if you maintain only, if you give a proper dose only, it will show the action. So if you are not maintaining the proper dose and if you are not following the correct procedures, or the ADME functioning will be altered. So if ADME function is altered, you cannot get the response of the drug. So you have to see that all the PK and parameters should be taken into consideration and you have to give the correct dose to the correct disease. Okay, next, hypersensitivity and adverse response. So allergic responses generally are not dose related. Allergic drug reaction can occur at extremely low drug concentration. A patient's allergic reactions are important data that must be recorded in patient's profile along with other adverse reaction. So you know that allergic responses, so if some of the drugs will be having some disadvantages, that is nothing but some whenever you take any drugs, you'll be getting some allergic reactions. So whenever you want to cure the allergic reactions, you will be taking only minute doses to cure that one. Okay, so whenever you are continuing any dose to a patient, you have to take the allergic response of that also. So if the person is feeling allergic, or if he is feeling any sensitivity to that drug, so that should be noted in the patient's record. Okay, so that is nothing but hypersensitivity and adverse response. So if any drug is administered to any patients, if he is showing any sensitivity reactions, or if he is having some allergic reactions, you have to note in the patient's profile. Okay, so that is hypersensitivity and adverse response. Next, eighth one is a drug distribution and pharmacological effect. So after the drug distribution, how the pharmacological response will be there. So after systemic drug absorption, it circulates throughout the body and most of the drug is passively stored, which produce an adverse effect or be eliminated. So some of the drugs, so not all the drugs will do like this, but only some drugs, so after reaching into a systemic circulation, they will be stored at some part of your body and it will show some adverse effects. Okay, so here we can see the term called as the effect compartment, which is nothing but a fraction of the drug reaching the target site and combined with the receptor which is located in the tissue. This receptor site is called as the effect compartment. So effect compartment is nothing but one of your target drug molecule will reach to your site and it will be combining with the receptor present over there. So that receptor is called as the receptor compartment is called as the effect compartment. So the time course of the drug delivery to the effect compartment will determine the rapid or delayed onset of action. So that is nothing but, so by whenever the drug is coming and reaching to this receptor, and if it is I told you no, so effect compartment is nothing but the receptor site at which the drug will be coming and binding with that. So the time course, that is nothing but when you are administering any drugs, for how much of time the drug is coming and reaching to your receptor site will show the onset of action. So if it is coming very late and if it is binding there, the duration of action will be very slower. So if it is coming faster and binding to the effect compartment, then your action will be very faster. So that is the difference. That effect compartment is nothing but this is the compartment where the drug molecules will target and come to this receptor site localized in a specific tissues. So that compartment is called as the effect compartment. So when whatever the drug molecules that are coming and binding at this effect compartment will determine the onset of the action or the delayed result of the action. Okay, so the delivery of the drug to the effect compartment is affected by, so in which cases you will see the slow motion of your drug molecules to the affected compartment means, so it may be due to blood flow. So if the blood flow is very lower, so the drug molecules cannot go and bind at the specific regions. Next, partition properties and diffusion of molecules and receptor molecules. If the receptor molecules are not high, so then drug cannot go and bind with that. So these are some of the parameters which affect the binding of your drug molecules at the site of the compartment. Okay, so by combining the PK or PD changes, it is possible to determine whether an observed change in pharmacological response is due to BD factors such as tachyphylaxis or tolerance due to PK parameters. So by seeing this one, by studying about this effect compartment and by combining both PK parameters and PD parameters, you can say that what are the adverse effects that you are getting. So if you are getting the adverse effects due to PD factors, it may be like tachyphylaxis, or if it's due to PK parameters, you will be seeing some conditions like tolerance. Okay, so that is about your drug distribution and pharmacological response. So in the drug distribution, you have to write about the effect compartment and what are the factors that is going to affect to the affected compartment from the drug molecules, and you have to explain that by combining the parameters. You can say, so whatever the effect shown by the drug, or whether it is a delayed one or whether it is a rapid one, it is determined only by considering the PK and PD parameters only. Okay, so this is your 8th point. Next, the 9th point, that is drug receptor theory relating pharmacological effect and dose. So here the relationship between pharmacological effect and dose was proposed by a scientist called as the Wegener, who related the drug concentration to the pharmacological effect. So as you know that as the drug concentration increases, your drug pharmacological effect will be also increasing. So here one or more drug molecules interact with receptors to form a complex that in turn elicits a pharmacodynamic response. So in some cases what happens, so the drug whenever it reaches to the receptors, it will be getting formed like a complex. So that complex will show the response. Okay, so that is nothing but your drug receptors. If you are having any receptors, if it is forming any complex also, it will show the action. Without the formation of the complex also, it will show the action, but whenever it forms the complex also, it shows the response. That is pharmacodynamic response will be there. That is, it will show the onset of the action. Okay, so next, the last one is a drug exposure pharmacologic response relationship. So this relationship is used to predict safety and efficacy and provide valid hypotheses about the effects of alternative doses and dosage regimens not actually tested. So this term exposure refers to dose and various measures of acute or integrate drug concentration in plasma and other biological fluid. Response refer to the direct measure pharmacological effect of the drug. There are many different types of models are there which are used to predict the relationship between exposure and response, like descriptive PD model, empirical model that link PD model, and PD model. So here drug exposure to pharmacological response is nothing but, so in the simple words, you can say that if you are going for alternate dosage forms, that is if you are giving the alternate doses and if you are giving the correct dosage regimen, if you are performing the correct dosage regimen and giving to the patient, then you will get the correct pharmacological response. So if you are altering the doses without the studying the person's or the patient's body structure, or if he is having any past medical history, without that if you are giving any dosage suggestions, you cannot get the 100% result. So it results to the if he is having any acute infections or acute drug concentrations. So if he is in the past medication history if he is there, or if he is taking any of the medicines. So all these parameters should be taken into consideration. That is nothing but drug exposure, that is the previously how the drug has shown. That is, if the patient is having some previous medical histories, like if he is having some heart attack or if he is having some BP, so you have to check that what are the concentration levels that are there in the blood. So you have to see that one, and you have to give the correct dosage regimen, okay, by considering all the patient parameters and also the medical history only. You have to give the correct dosage regimen. So that is nothing but the dose should be correct, okay. So then only you will get the pharmacological response, that is onset of action will be shown. You will get the 100% result, okay. So there are different types of models are there, which will explain the relationship between your exposure of the drug to the response. So these models like descriptive PD model, pharmacodynamic model, and empirical model, and PD model. So we don't want any description of these one, but these are the general names of models which are used to give the relationship between your exposure and pharmacological response, okay. So these are the 10 points you have to remember and write individually. So whenever you are going to ask, whenever I ask you to write on the pharmacokinetic and pharmacodynamic correlation in drug therapy, okay. So this is about your pharmacokinetic and pharmacodynamic correlation in your drug therapy, that is in your 4th unit.